These are actual meal replacements. Each packet has all the nutrition that you should be getting from an actual meal without the calories. Hello and welcome to this edition of the Wise Medical Minute. Today we're going to talk about one of my favorite and one of my least favorite topics, obesity. Basically, we want to give some general tips for people trying to lose weight. Now, we do a lot of work with body contouring, and it comes up all the time when we're trying to establish those perfect hourglass figures. I can do amazing things with my cannulas in terms of reducing inches. But good Lord knows I sometimes need a little help with the pounds, okay? We don't remove things by the pound when we do our body contouring procedure. So I've been accused of neglecting adequate emphasis on weight loss as part of how we make bodies beautiful. So thus today's topic. Now historically, I have been successful with a regimen I call my common sense diet that I've used since the mid-'80s. And in quick summary, it basically allows you a few things you can carry around in your head to eliminate unnecessary calories. Now, the first little tip in the common sense regimen is don't drink your calories. If whatever you're drinking has calories, it's probably not a good idea during a period of time with aggressive weight loss. And sugary beverages should be illegal. Things like alcohol have no intelligent reason in the regimen for someone trying to lose weight. So if whatever you're drinking has calories, it's probably not a good idea. The second little tip in the common sense regimen is no fried nothing. Grammar error intended. Okay, so if you have fried foods, it doesn't matter if it was healthy to begin with, but the same food, if you eat it raw, bake it, broil it, microwave it, anything but dipping it in batter and then dipping it in grease, the same food would probably be a lot better choice for a weight loss regimen. Now, the third thing is eliminating things like the sauces and the gravies. And I always use the moniker, it ain't what you eat, it's what you did to the food. Okay, when you pour a bunch of sauce or gravy or whatever other condiments, those are all unnecessary calories that bring nothing nutritionally to the conversation. And last but not least, portion control. If you're used to eating that much, it's a lot more reasonable to cut it down to that much. And I always use the analogy of a 16-ounce steak, okay? An adequate portion for protein would probably be a 4 to 6 ounce steak. So when you eat 8 ounces, that's 2 portions. You eat 12 ounces, that's 3 portions. 16-ounce steak, like we had the other day, ought to be a felony. Okay, because you're eating 4 portions and a whole lot more protein than you need for a given session. So portion control is the most difficult part. And you can tell people from foreign countries when you go out and you have a different kind of cuisine, they see a bunch of Americans walk in, they fill up the plate with rice, or they fill up the plate with noodles, or they fill up the plate with larger than we need portions, because that's the way we eat. So that's the biggest thing we need to change as far as just common sense measures. Now, what happens when you want to get more aggressive? I do believe there is a place for appetite suppressants when appropriate and properly medically supervised. Okay, proper medical evaluation beforehand to make sure you're not at risk for things that the appetite suppressants could make worse, and monitoring periodically while using them to make sure complications have not arisen. We use a helpful adjunct, I'll call it, in almost all of our weight loss programs, where we use the Lipotropic B12 injections. Now, there's different versions of these injections, and it matters which one you're getting. Now, people refer to them as the fat-burning shots. That's a little bit of an overstatement. But if you're consuming few enough calories that your body is actually burning fat instead of whatever you ate for fuel, then the 3 ingredients in addition to the B12 do make a difference. There's methionine, there's inositol, and there's choline in addition to the B12. And honestly, I don't know what the B12 does, but everybody swears by it, and it appears that it won't hurt you. So I have no problem with the B12, and it's just something that has no obvious scientific basis, but anecdotal data is the most powerful data, and people swear by it. So it's included in addition to those cofactors that actually do help burn fat more efficiently. Those other ingredients allow you to get more energy out of the same calories of fat being burned, because your body prefers carbohydrate and protein as its source of energy. So if you're burning fat, the B12 shots do make a difference. In recent years, we've also started adding other amino acids and vitamins to the shot when appropriate and when requested. So some people want L-carnitine, some people want the B complex, some people want vitamin C. All these things can be compounded within the shot, but I don't push those because you can also take those in a multivitamin and get quite adequate results. So in questions about the fat-burning shots, the truth be told, yes, women love them because they seem to get a lot of energy when they're on a diet. But they don't do as much if your total caloric intake is not below a reasonable level such that your body is actually burning fat. If you're eating enough calories that your body's not burning fat for energy, then B12 doesn't do anything. So we have to be fair and tell you that. So you have to cut the calories. Now, as a tool to facilitate cutting calories more aggressively, we recently started inventorying our own privately labeled Wise Choice Meal Replacement Program. Now, this is a modification of products that I've worked with since the 80s, and basically these products originally were designed to be a so-called protein-sparing modified fast. Now, certain versions of these powdery shakes, puddings, or however you want to make them, can be used as your exclusive source of nutrition for periods of up to several weeks. And we can safely use these products and get your caloric intake without compromising any of your healthy tissues down as low as 500 or 600 calories a day. Now, when these were developed back in the 80s, there were products that even could accomplish all of the micronutrients, vitamins, minerals, and electrolytes with as little as 330 calories. But in recent years, the protein requirements that people are recommending in the so-called modified fasting state are increased. And I like to keep the calorie count under 800, and we can do that with 4 or 5 of the servings of our meal replacement, in addition to what I call our allowable veggies. So you can be quite full with the allowable veggies, and you can be quite adequately nourished with the meal replacements. These are not supplements like you can buy in a drugstore or at Sam's or Costco. These are actual meal replacements. Each packet has all the nutrition that you should be getting from an actual meal without the calories. So at least 15 grams of protein and all the other micronutrients that you need, just enough fat, just enough carbohydrate, in addition to all the added nutrients. And as a means to an end, the so-called modified fasting, the protein-sparing modified fasting approach works. It really can generate as much as a half pound to a pound a day. And the downside is 80% of people who use this approach to lose 20, we can't count how many 20 and 50 pound lost people we've had. A lot of people have lost as much as 100 or more on this kind of a regimen. But 80% of the time, the downside is people gain it back. So we have to make that aware. But 20% of the time, people keep it off. So your goal going into one of these approaches has to be, I'm going to be in the 20%. Okay? So I'm living testimony that most people gain it back, but not everybody does. So we're going to spend more time in the future talking about maintenance of successful weight loss after we've achieved the weight loss, because we've pretty much getting the pounds off down pat, but we haven't been as successful in helping people to maintain their weight loss. So I solicit suggestions in that regard for future videos, because we can get the pounds off. We want some help in helping people to keep the pounds off. So if you have suggestions, I solicit your recommendations to info@wisemedicalcenter.com, and we look forward to your listening and participating in the next edition of the Wise Medical Minute.
Thank you for listening to the Wise Medical Minute with Dr. Thomas Locke. Dr. Locke addresses current events as well as important medical issues using responsible, unbiased journalism approached from a medical perspective. We invite you to submit questions or comments or suggestions for future topics by email to info@wisemedicalcenter.com. Again, thank you for viewing the Wise Medical Minute.